Minister, well.
With permission, Mr Speaker, I'll take questions 1 and 9 together. The Government is committed to ensuring patients can access timely, high-quality care wherever they live in the United Kingdom, while recognising ongoing challenges. We are working with the NHS and devolved governments to improve digital interoperability, streamline cross-border billing and support more joined-up care.
Thank you,
Mr Speaker. Powys has no general hospital, and therefore my constituents are dependent on access to English hospitals for the treatment and the operations they need. Yet last July, Powys Teaching Health Board made the decision to extend waiting times for Powys patients awaiting operations. And that means that many of them have now been waiting years for their operations, often in agonising pain. So will the Minister meet with me, Powys Teaching Health Board and the new Welsh Health Minister to make sure that Powys patients get the funding and treatment they need?
I thank the honourable member for his question, and of course I would be very welcome to meet with him. Decisions he knows about waiting list management in Wales are matters for the Welsh Government, but I do agree that patients in border communities should be able to access care as quickly and conveniently as possible.
John Lamb.
Thank you, Mr Speaker. For my constituents in the Scottish Borders, accessing NHS treatment can sometimes be more complicated than it should be. Some residents in the Scottish Borders are registered with GP practices in Northumberland, but their medical records are not always shared properly between NHS services in England and Scotland. Now, the SNP government refuses to allow reciprocal care, so will the Minister urgently work with the Scottish Government to ensure my constituents can be properly treated as closer to home as possible?
I thank the honourable member for his question. I am aware of the concerns he's raised where NHS organisations on both sides of the border work together to improve access for patients. NHS England is working closely with NHS Scotland to improve the compatibility of patient records. I believe that they must do much more, and I'd be happy to meet with him to discuss further.